go through together is how to do a proper in-home exam. Now, this is in no way to replace any doctor's visits or diagnose any problems at home. This is solely to look for any issues with a dog that may not be your own. Now, there is a lot of information to go through with this, and typically a lot of it would be more with a vet per se, but I'm going to focus on the head with Squid, as again, I think that's only where his attention span will lead us to. So with Squid, you're going to see, sit boy, that he does have some staining around the eyes. Now, that's typical just with small white dogs tend to have this, so don't be alarmed with that. When we're looking at the eyes, we're really going to make sure there's no redness of the white part of the eye or any excessive redness of the pink part of the eye. A little hard to see in videos with him, as well as you want to make sure any discharge that's coming from his eyes is not mucus or pussy of any sort, nothing like that. General tear staining, what he has, you may be able to see in the video, is normal. We just don't want to see it that yellow or green discharge that could indicate an infection of any sort. Also squinting as well, anything like that, or pawing at the eyes can indicate an irritation to the eyes as well. Now, Squid, I'm sure you've noted, does not have any teeth, so that's why his tongue does hang out. But typically, if you do have a dog with teeth, you can just, if you're comfortable, look for any cracked teeth. If you notice any excessive drooling, anything like that, again, only go with the comfort of the dog. Do not just be sticking your hands in this patient's or this dog's mouth if you're uncomfortable or you haven't had gained any trust with this dog as well. If you notice any excessive drooling with them as well, any lip smacking, that can be an indication of nausea or any dental issues as well. I would only look in the mouth if you notice any of those issues, to rule out any cracked teeth or anything like that. This isn't a typical standardized exam that you do at the vet. So again, only if you're seeing any issues. Another one we can do is, again, at the comfort of the dog, if you are comfortable proceeding with this. Some dogs don't like their ears being touched in general. Squid does have very large pointy ears with a Chihuahua. Now, some dogs with the droopy ears, you may note that they can get some odor or discharge or sort of pawing or scratching at the ears that could indicate an infection. So we just want to simply take a look at what we call the pinna, and that's the external part of the ear. Make sure there's no redness or crusties in that area as well. I would not recommend putting any Q-tips or anything down the ear canal to check for any debris of any sort. That can actually push the debris further into the ear canal and cause further irritation. So definitely something you want to avoid. Generally, any yeast infection of any sort in the ears are very potent. So if you do notice an odor with the ears and that redness or any pawing, it's a good indication to get them to the vet to see if there's any other issues going on. With Squid's coat, he's nice and clear, so you're able to see any bugs or creepy crawlies, but sometimes even just brushing your hand along the side of the dog or on the back, you can have a good indication of if there's any creepy crawlies or anything that needs to be addressed with the vet as well. Usually there's anything like scratching or some hair loss in those areas. If they do have any ectoparasites, we do need to be concerned about. Another good thing to look for is Squid does not like his feet being touched overly, so I'm not going to push him to his limit, but you may want to note if there's any excessive growth in the nails that can show in some limping or some lameness. That's a good way to rule anything out if you feel those nails are a little bit longer. Sometimes if they are limping, it's really hard to rule it out at home. I wouldn't really recommend any palpation along the joint or anything like that. Again, we don't know what's wrong with them, so if you notice anything like that or non-weight bearing, definitely take them to the vet to have that assessed. But other than that, really we want to look for any elimination habits. Make sure there's no straining to urinate, straining to defecate, any blood in the urine or stool, or anything like that that could indicate an infection or an illness of any sort as well. Right.